1 crore people have registered already, 27 lakh per minute. India Today's Sneha Mordani gets you more about the registration and perhaps the niggles, the problems that lie ahead.
Jabs for all adults. Yes, on paper, but no, in reality. The government has asked states to use stocks of the vaccine in such a way that only the freshly procured vaccines directly by the states from the vaccine developing companies are used for inoculating those above the age of 18. Which means the over 1 crore doses lying with states can be used only for the priority groups. States have already highlighted the problem of inability to procure doses from vaccine companies on time.
We should be very clear that if we have a stock, let us say, of 4 lakh vaccines today, suppose we have even a stock of 50,000 vaccines on the 1st of May. Can we use the stock of the government of India for vaccinating those between 18 and 45? We cannot.
Please just tell me, what is it that you expect? Do you expect the centre to do most of the procurement for you and give it to you, because then the price parity is maintained and you want to do some amount of procurement and deal with both Serum Institute and Bharat Biotech yourself?
From day one, since the vaccination program has started, I have been on record saying that if there have been various choices, people have said various things. But I have always maintained that there should be only one agency purchasing the vaccine and supplying it, and that must be the government of India.
Apart from Chhattisgarh, Punjab, Rajasthan, Assam and Jharkhand have also been told by vaccine developers that fresh stocks can be provided only after mid-May. The centre claims they have provided 16 crore doses already to the states. More than 1 crore doses are lying with the states. More than 57 lakh doses will be provided in the next 3 days, says the Union Health Ministry. The centre has also shared a breakup of availability of doses with the states. It has also claimed wastage by the states. Experts also say, given the shortage, there could have been better prioritization.
Vaccine dosages will be in short supply, and not everybody may be able to get vaccine at that time. So it is very essential that we focus the vaccine on those districts which have the maximum cases of COVID-19 in each state.
In addition, registrations in COVID, the only way to get a shot since walk-in vaccinations from 1st of May for those above the age of 18 is not allowed, saw many glitches. The software faced numerous challenges. For some, the OTP could not be generated. For others, the slots were not allocated even after successful registration.
We haven't been able to get the OTP because every time you need to register or enter the CoWIN website, you need an OTP. And the OTP is valid for 3 minutes, but it comes after 5 or 6 minutes, which renders it completely useless.
So I got my OTP, I registered myself, but I couldn't able to use the slot because it's showing it is only for above 45 years age.
Well, in spite of the centre opening up the vaccination drive for those above the age of 18, there are many problems. A, there is a shortage of vaccines already. B, the centre's directive to states to only use vaccines for those above the age of 18 that they have procured themselves from these companies directly is going to create a lot of hindrance in the effective starting off of this drive. There are no walk-in vaccinations for those above the age of 18, and registering with CoWIN also is getting extremely difficult. The wait for those above the age of 18 is only going to get longer. In New Delhi, Sneha Mordani for India Today.
So 1 crore have registered already. Do we have enough vaccines? Do we have enough doses? Joining me on India First, Dr. Harsh Mahajan. He is the president of Nat Health, the National Health Federation of India. Also with me is Dr. Ravi Malik. He is the chairman and managing director of the Radix Hospital. But before I come to my guests, let's quickly listen in to the opposition targeting the Narendra Modi government on the vaccine policy, still insisting it remains discriminatory.
Central government's vaccine policy has come under a huge question mark, more so after they agreed to our demand of allowing 18 to 45 years of age also to be vaccinated. Now, the states are finding it difficult to procure vaccines for their population from the companies. The center cannot wash its hands off now. They'll have to take the responsibility since they were in the driver's seat. They can't abandon the vehicle midway and now ask the states to handle it themselves. The center must find out from these manufacturers and ensure that states get their share of vaccines.
ஒரே தேசம், ஒரே தேர்தல், ஒரே ரேஷன் கார்டு, ஒரே வரி, ஒரே சந்தை, ஒரே மதம், ஒரே உணவு, ஒரே மொழின்னு பேசுற பாஜக ஆட்சியில் உயிர் காக்கிற மருந்துக்கு 3 விலைகள். ஜிஎஸ்டி அமலுக்கு வந்த பிறகு மாநில அரசுகள் தங்ககிட்ட இருந்த வரி போடுகிற அதிகாரங்களையும் பெருமளவுக்கு இழந்துடுச்சு.
So the opposition has come out all guns blazing, but 1 crore registrations. What's the road ahead likely to be from the 1st of May? Dr. Mahajan, 1 crore have registered between 4 p.m. and 8 p.m. Sir, is that an indicator that vaccine hesitancy is either not there or is it on the decline? But are we prepared, sir? Are we prepared to vaccinate people between 18 and 45?
Thank you very much, Gaurav, for having me on the show. And do give me a few minutes so that I can put the new policy into perspective in front of the viewers. One, the very fact that the COVID app has been capable of registering 1 crore people in one day and as per you in 4 hours means that it's a very robust system, and whatever glitches may have happened, those will be sorted out. 1 crore is a huge number, and that the country has been able to produce an app which is capable of handling this kind of traffic is amazing. Now let me delve into how I understand the new policy. In the new policy, the central government is going to procure 50% of all doses, and these are going to be given to the states to carry out through the government hospitals vaccination for 45 plus, something that has been on since the last few weeks. So nothing is going to go wrong as far as the current vaccination program in the government hospital goes, because this is going to be free of charge, and this is going to be dose which is ensured by the central government to reach the state governments. That's point number 1. Point number 2 is about the new registration of people in the 18 to 45 age category, which is where we want to ramp up and increase the number of people who are vaccinated. We know that it's the younger lot who are going around now working and hence getting infected. Now here, for the balance 50% of the doses, it is the state governments and the private sector which have to vie for those doses, and it's as yet not clear what will be the system, which state will get how much. Will it be based on some kind of negotiation, or will it be that based on the population of the 18 to 45 age group, it will be distributed to different states? That's not clear. Now
in such a situation, Dr. Ravi, Malik, and if I may, Dr. Mahajan, is the private sector, are private sector hospitals geared to roll out on May 1? And is there merit in states like Maharashtra saying that we'll wait, we'll build up on stocks and then start?
Look, as far as the vaccination in the private sector is concerned, I'm also running the vaccination center in my hospital for last almost 2.5 months since the vaccination process started. Now the issue is that I'm little skeptical about it. Now you see the avalanche of people are coming. Registration of 10 million people over a period of 4 hours means a lot to us. Under the backdrop of fact that the manufacturing capacity of both the companies is not more than 8.5 million per month. And this is a registration on the other side. It is a registration to the tune of almost 10 million in 4 hours, and we have 2 more days to go for 1st of May. So, we need to be absolutely sure about the availability of the vaccine, number 1. Number 2, My concern is that it can become a super spreader event also. If the people are not taking care, or if the vaccination centers are not taking care of the social distancing and so many other COVID appropriate behaviors, then this may turn out to be a super spreader event also. My third apprehension is that from 1st of May, all the private players, they are supposed to be procuring their vaccines from the manufacturer from the manufacturing company.
Yes.
Now the issue is that, like, I'm running a private hospital. Now government will not be supplying me. It is my headache to go and contact the manufacturer. So we have been trying. My medical superintendent has been trying to contact the manufacturer, but we are not able to procure any dose. So now what is going to happen is, from 1st May, a lot of people will come for vaccination, especially those whom we have given the first dose. They will be coming for the second dose. Besides the, the people who are in the range of 18 to 45 years, they will be coming to us, and we will not be having any vaccine. So there are a lot of hiccups which we are going to face. And
Dr.
under the
Mahajan,
backdrop of fact that there has been an astronomical increase in the cases, people are now apprehensive and they want to get the vaccine urgently and immediately.
Okay, Dr. Mahajan, will private hospitals be able to vaccinate people starting the 1st of May? Can and will they be able to get stocks in time and in numbers that may be required?
I'll be very frank, Gaurav. As things appear now, the private sector will not have a single dose to give on day one in the entire country. Till now, the doses were coming through the government network and were being supplied to the private sector. And what the private sector was basically doing was dispensing those doses and putting the jabs in the arms of people. We have spoken as an organization to several manufacturers, and the earliest they say they can even consider the demand of the private sector is 6 to 8 weeks from now. We have spoken to international companies which make the vaccine, and their reply is that they will not deal with the private sector. They would rather be dealing with the governments across the world. So as things stand, we will be competing with state governments for a dose from the indigenous manufacturers. And I don't think the private sector stands any chance of getting any dose. And definitely, I can tell you, unless something else happens, on May 1, there will be not a single jab given by the private sector.
That's a call for...
I would really like to request, Gaurav, just 30 seconds more.
Go on, sir.
That till such time that the private sector is able to get its house in order, be able to actually talk to the companies and see that seriously whether they are even willing to give the vaccine to us, the supply should continue as it is from the government side, whether it be the state government or the central government. Otherwise, from the private sector side, which is very keen to join this fight to vaccinate as much as possible, not only in hospitals, but even in labs, in diagnostic centers, in clinics, because the quicker we apply, the quicker we supply the jab to more and more people, the higher the chance of us containing the pandemic. And so somewhere I think we have to discuss with the government so that in the private sector, the vaccination doesn't stop.
But this is a race against time. All these decisions should have been taken as on yesterday, if not day before. And if it's still not decided, because Dr. Malik, that's the question I was coming to, the point that Dr. Mahajan raises, that not just private hospitals, but diagnostic centers, clinics. My question was, Dr. Malik, should this happen in special camps that should be set up for people to get vaccinated as quickly as possible, since this is a race against time? And what's your vaccination implementation plan? Dr. Mahajan says that private sector will not be able to vaccinate anyone between 18 and 45 on the 1st of May. Is that also your fear?
Yeah, it is my apprehension. It is my fear. And I must tell you, the house of cards is going to fall down. Private sector has played a big role in the last 2 months drive of the vaccination. 10,000 hospitals which are linked with Ayush scheme and 687 hospitals which are linked with CGHS scheme. So plenty of them are private hospitals, and they have given a big support to the government in the giving of the vaccines. Now, my apprehension is that if the private sector is not provided with the vaccines, and so much of people are coming, they are flooding to get the vaccine, that it will not be possible for the government to give all these vaccines at selected government centers. Secondly, government should also allow all the small clinics and physician clinics and general practitioner clinics and labs also, so that they can also procure the vaccine. So now there are thousands of lakhs of clinics in India. So how every clinic will procure from the manufacturer, it is a matter of a big question. So I must tell you that if 1 crore people have registered in 4 hours, in coming 2 days, the figure might reach to 50 million. And that is not the capacity. And with the private sector not in the picture, I don't think that this program will work. Maybe the government might have something in the mind, so I can't say that. But by and large, moreover, the second thing is the people who have taken first dose from us, we have given thousands of the people the first dose, they will be coming for the second dose. So if we have no second dose, then even the initial campaign will suffer for that.
But wouldn't a second dose continue to come? Dr. Mahajan, the central government will continue to acquire, the central government will continue to dispense. But is that going to happen only through government hospitals, or the system that was existing to give those doses to private sector for 45 plus and those with comorbidities and healthcare workers, will that system continue, Dr. Mahajan, in your appreciation?
No, that system will not continue, Gaurav. The government has very clearly told the private centers that whatever doses are left over at the end of April, they have to be returned. So the private sector will not have any doses to dispense, even to those above 45. Having said that, I must clarify that those who've had say a first dose at Dr. Malik's hospital can always go to a government hospital where the doses for plus 45 will be available.
But wouldn't that again mean longer queues? And longer queues is what we are trying to avoid because of perhaps, and God forbid, can these centers end up being COVID hotspots? Like India Today's Milan Sharma gets us this report, because that's a genuine fear. Dr. Mahajan, you raised it. Dr. Malik, you raised that point. Could the vaccination initiative, and if many people come there and don't follow COVID appropriate behavior, can they become COVID hotspots?
Mumbai, Tiruvananthapuram, Kolkata. Crowds at vaccine centers seem to have crushed vaccine hesitancy in India. While vaccine is a shield against the corona infection, vaccine centers could turn out to be super spreaders. Because no social distancing, incorrect masking, masks on the chin, nose exposed, the risk of catching COVID-19 infection is high even at vaccination centers.
We are at the Nesco Vaccination Center in the suburban area of Goregaon in Mumbai. First of all, have a look at the long queue outside the vaccination center. The biggest fear among the Mumbaikars these days is whether or not they will get the vaccine in time or not.
As some centers run out of vaccines, angry outbursts at the centers have become common.
हमारा रजिस्ट्रेशन सायन हॉस्पिटल में था, अभी हम वहाँ गए, वो बोलते नहीं है। हमने बोला बीकेसी में पहला डोज लिया, वहाँ जाएं, क्या बोले हाँ वहाँ स्टॉक है। तो हम टैक्सी करके आए अभी यहाँ पर, और अभी यहाँ बोल रहे नहीं, आप नंबर लेके जाइए।
7 हिल्स में हमने फर्स्ट डोज लिया था, वहाँ पे नहीं था, तो हम यहाँ आए, तो यहाँ भी नहीं है, अब वापस घर जाएंगे।
वहाँ पे भी बंद है, फिर यहाँ पे आए।
These long lines tell you the story of people standing to get the second dose of the vaccination, whereas on the other side there are people waiting to get the first dose of the vaccine. There are senior citizens in this line and they are facing difficulties because standing in the sun, many of them have been standing from half an hour to some even 1.5 hours. There is no clarity when they're going to get their form. Those who've got their form, there's no clarity when they're going to get the second dose of vaccine, but they are waiting, they are hopeful.
While vaccine is the only antidote to save India from this crisis, COVID inappropriate behavior is doing much more harm than anticipated, especially during the second surge.
आप अनुशासन से काम कीजिए, कोई भीड़भाड़ वहां पर न कीजिए और ऐसा न हो कि वैक्सीनेशन के सेंटर्स ये कोविड-19 संक्रमण के सेंटर्स बने, ऐसा न हो, ये खबरदारी हम सभी लोगों ने लेने की जरूरत है.
Expect more rush as vaccination opens for all above the age of 18 years.
The government and the health ministry have warned that only after taking a confirmed appointment booking on the CoWIN platform should one step out to the vaccine centers to get the jab, to avoid the sort of overcrowding that is being witnessed at this point. The question is, will people wait now as COVID surges and the vaccine remains the only antidote against the virus? With Bureau Reports, this is Milan Sharma for India Today.
There are very pertinent points that have been raised by Dr. Harsh Mahajan and Dr. Ravi Malik. For the moment, doctors, many thanks for joining me.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.